Please be aware that this episode contains discussion around mental health, and one of our speakers will be talking briefly about suicide. Welcome to HIV Reimagined, UNICEF's podcast about the future of HIV and health programming. I'm your host, Dr. Shafiq Isaji, and today's episode is a different one, but one we're very excited about because we're talking about healthcare for young people. And even better, we're not the ones doing the talking, young people are.
Which is why, for one episode only, we're saying goodbye to Shafiq and hello to me, Stephanie Ndlovu, and more importantly, hello to Viet, Mutua, Miriam, and Nick, who are joining me from Vietnam, Kenya, Copenhagen, and Jamaica to talk about all things healthcare for young people. Hi, guys.
Hi, everyone. Thank you.
Hi, guys. I'm so excited to have each of you here to share your experiences, and we've got so much to chat about today. All right, so let's get straight into it. I'm going to start by giving a proper introduction of myself. My name is Stephanie Ndlovu, and I'm a South African actress. I played the role of Tulu on MTV Shuga Down South Season 1. Now, MTV Shuga is an award-winning behavior change youth drama, and it reaches millions of households across the world. And I'm also a co-chair for MTV Staying Alive, which is an international behavior change organization. But this episode is not about me and the things I do. It's more about you lovely people and the amazing work that you guys are doing. So with that, I would love to start by you guys just telling me a little bit more about yourself. Nick, are you okay to start?
Hi, everyone. So I'm Nick, born and raised in Jamaica. Find myself most interested into things like tech and climate change. A lot of the work that I generally do has to do with getting young people involved and galvanizing the voices of young people in a lot of these spaces. I'm first and foremost a youth advocate.
Fantastic. Thank you so much for taking time out. Miriam?
Yeah, so my name is Miriam. I am currently in Copenhagen, but I grew up in Egypt and Germany, and I'm studying my master's degree in global health at the moment, and am writing my thesis on sustainability and digital health tools. I'm also really excited about the digital side of things, but I think the people should be in the center, and I'm more excited about how digital health is serving people or making things easier for people.
Great stuff. That is amazing to hear. Thank you to you too for joining us. And Viet, over to you.
Hi, everyone. That is Viet. I use he, him, his pronouns, and right now I'm serving as the health program coordinator at Lighthouse Social Enterprise in Vietnam. Speaking from experience, I totally resonate with the person-centered approach that Miriam just mentioned. That's the approach that I would always take when I'm conducting any research, doing any community outreach, leading any intervention programs, and even when I'm advocating for the voices of young key populations and LGBTQ plus youth, in conversations with the government, with the UN, and with any development partners in the region. It's totally great and such an honor to be in this podcast with everyone.
Amazing. Last but definitely not least, Mutua, over to you in Kenya.
Hello, everyone. My name is Mutua. You can call me Mutua Arts. I'm a graffiti artist, expressionist, muralist, portrait artist, canvas artist. So mostly my way of art is talking about what's happening around in my community, both positive and negative, and expressing my view, coming up with solutions of any problems that are in the community through art.
Great. Cannot wait to hear from all of you guys. Plus, later on, we're going to be hearing from Nelma about the power of involving young people in service design. And we're going to be finding out how gaming can be used for good, which I'm really excited about. We might even be talking to one of MTV Shuga's very own peer educations, which obviously I'm a little biased about. So it's a bumper episode. And what I wanted to start with is an issue I think that affects all of us in our individual capacity and in the work that we do. And that is mental health. Now, I'm sure we've all come into contact with it through ourselves or, people we know, or just living in the times that we're living in where mental health is concerned. So I'm going to start off with Nick. It's a bit of a big one, right? Mental health. But you mentioned that you're on the U Report Youth Council. So maybe you can start off by explaining to us exactly what is U Report.
Yeah, so your report is essentially like a social platform where young people can send messages and interact with people and bots via Facebook, Messenger, WhatsApp, and SMS text messages. And so essentially what we do is send out different polls to try to gauge the understanding of the social stratosphere of youth and to better understand what they think about certain issues, how they feel about certain things. And we do that on either an ad hoc basis or maybe even a weekly or even monthly basis.
And U Report is anonymous, right? Why do you think a platform like this is so needed?
Historically, young people have not been given a voice. What you tend to find is that many of the decisions that are made at the high end policy level don't necessarily dig deep into the bottom up theories of change. And so your report is supposed to be the plug or the buffer for that, to give as much perspective as possible so that there can be better and more deep-rooted strategies created that involve young people.
And when it comes to strategies that involve young people, why do you think they're especially lacking when it comes to mental health?
Well, two things are at play. The first being that I guess the generations before us have really not been equipped with understanding mental health, at least in the ways that issues per se show up for us. The second is that we've had the advent of technology, and so compounded onto the fact that the past generations weren't equipped in this way, technology more or less accelerates the problem in and of itself by providing tools that are more or less geared towards addiction. And so that addictive trade or that addictive trope of technology, at least in the ways that it is more or less designed today, does not lend well to how we, one, understand mental health, and two, how we navigate mental health spaces and how we even take care of ourselves generally.
It's interesting. Thanks, Nick. And we're going to talk more later about the positives and negatives of social media and tech. But I'd love to know what you all think the impact of the COVID-19 pandemic was on young people's mental health.
If we definitely thought that just the introduction of technology as we know it today accelerated the problem, the pandemic more or less just gave it like a jump, like a huge spike. And that's mainly because majority of us, or maybe even all of us, were just trapped inside, quote unquote. And that led to the usage of technologies that were already broken before. Those two things at play, it typically leads to a few more disastrous results.
Mm-hmm. Anybody else maybe want to jump in on the pandemic and mental health?
Yeah, I think I could take a jab. I think I could speak more on the experiences of young people who are marginalized. These populations are historically disadvantaged in terms of economics, in terms of their educational background, and also because of the societal stigma against them. In the pandemic, all those things got exacerbated for a lot of LGBTQ plus youth, especially those in Vietnam. A lot of them had to stay at home, with their very homophobic and prejudiced parents, and also got pretty much trapped in quarantine places where they feel physically unsafe, perhaps because of their landlords are pretty much like homophobic, or if they're like quarantining with their own partners, there could be a lot of intimate partner violence as well. So pretty much the COVID-19 pandemic exacerbated the issues that already existed before. So I think that could really contribute to the exponentially increasing rate of depression and anxiety and stress disorders among these populations.
Talking out of experience, I come from an informal settlement in Nairobi. During COVID, a lot of young people, actually my friends, lost their jobs because of the COVID rule of social distancing, and some spaces had to reduce some of the workers, and many young people ran into depression because most of them are young fathers, young mothers. As we sat in groups discussing, I noticed most of them are facing this but don't want to talk about it. So I came up with a way that I would show them it is possible to talk to someone and not be judged, which was creating mural pieces about it, showing them people they can talk to, organizations they can reach out to without being judged. So after getting several organizations, I want to get a number that they can be reached out easily. So once I do a mural on depression, I used to leave the number there. And surprisingly, statistically, after a few months during the COVID pandemic, the number was quite huge. It was about 10,000 young men who were reaching out, but they didn't want to attend the counseling sessions. They wanted to talk via phone in a way that they cannot be seen because they felt they wouldn't be judged.
Thank you, Mutua. Definitely an artist, as we can hear you sketching away there. Now, a couple of you have mentioned judgment. Do you think that young people have enough support from families and friends to help them deal with matters such as mental health? And do you think there's a lot of misunderstanding or just misconceptions from cultural, societal perspective as well?
Yeah, so we had done a poll back in 2018. By and large, about 90% of them said that they didn't feel supported at all. And I would imagine that's about the same probably today. It is mainly because parents, or at least past generations, aren't necessarily equipped to deal with some of the challenges that we face today. And just generally, at least within the context of Jamaica, it is not exactly probably the most nurturing environment for youth, at least in comparison to other places around the world. I find that young people tend to be on the edge a lot. There are a lot of things happening. Jamaica tends to be a high stimuli-oriented environment. We find that young people aren't able to necessarily cope with a lot of the things that they have to experience daily. Viet had mentioned just being able to, especially during the pandemic, just stay with their families and even with partners generally. In Jamaica, youth tend to be more abused. And so along with just being in the family orientation and setting, find that many of them either run away or try to run away because of the abuse that they might be experiencing at home. And just generally, probably at least over 58% of the youth that we had polled have considered taking their life or committing suicide.
Whoa, that's huge. Miriam, maybe I can ask you, what would you love to see change when it comes to young people's mental health?
I'm not sure if it's just for young people or in the sphere of mental health, but I feel like, especially when it comes to digital tools, they're mostly implemented in times of crisis. And I feel like that's not the best setting to introduce new things. There was a need already before the pandemic to have more and better information, education about mental health, like giving young people the tools to manage with problems, to manage stress in their daily lives. That just was really exacerbated by the pandemic, but I feel like the need was already there before. And I'm afraid that now that the pandemic is seemingly over, people are forgetting about these things again. And I feel like there's still the need to really implement more comprehensive mental health services that could be offered via digital means. That's really the government's or the nation's responsibility to really implement system-wide services for mental health and also other health needs.
Can I add a point? I totally resonate with what Miriam is trying to say. And on the other hand, I totally get what Nick is trying to say at the same time. Totally, like there should be like a threshold that we, as young people, like we should determine what that threshold holds for us in terms of where like the benefit could go and like where the harm could do. At the same time, I think as young people, trying to benefit other young people, our peers, I think that we should be the leaders of the service delivery. Any mental health support programs, any mental health services that are available, we should take a key role in how it should be delivered, how it should be designed, how it could be monitored and evaluated for future improvements or scale up. I think that would be the way to go in coming years. We at Lighthouse, we're putting forward a 2-year project that centers the leadership and the participation of LGBTQ plus youth with lived experiences of mental health needs to, consult, to provide, and to actually take initiatives in the project that we're doing, whether it be educating, like their peers on mental health literacy, whether it be informing their peers of what are the LGBTQ plus friendly mental health service providers out there, to also provide their peers with emotional support and crisis intervention online in anonymous manner, and also, to provide their peers with group counseling. So I feel like as we are centering the role and the participation of young people themselves, the impact is going to be almost guaranteed that the services and the programs that we're putting out are going to meet the lived needs of young people.
I really love what you're saying and appreciate it because it lends very nicely into the next part of what we're going to be talking about, which is peer education and being able to have people with lived experience on the ground carrying out the work, which has a huge impact on behavioral changes and so forth. MTV Staying Alive has a number of behavioral change campaigns. Its flagship campaign, being MTV Shuga, is a youth-based drama which focuses on sexual reproductive health issues, HIV, and so much more. Now, a huge part of it is the peer education program that works on the ground in the communities with young people, delivered by young people. We spoke to Vuyokazi, one of the peer educators, to find out what impact she thinks peer educators have on the ground. And just a note for everyone here listening at home, please be warned that this clip does include a reference to sexual violence.
My name is Vuyokazi. I'm based in South Africa and I'm from Cape Town, and I'm a peer educator from Snapshot, and I work under MTV Shuga and the program called Ukulungisa Ubuntu, Mending Humanity. And we don't want to be teachers or be counselors, so we want everyone to feel free and feel welcomed and also feel like the environment is safe for us to share. Because I'm not standing in front of them to be a peer educator, but I'm standing in front of them to be like, we are in the same age, right? Because I don't want to be like, I'm an elder, so you should listen to me. No. We create a safe space whereby we tell them whatever that we speak from here stays here, so that we allow them to feel free to be themselves as well.
In these sessions, the young people watch videos of people sharing their real stories. Vuyokazi was one of the people who shared her story.
As much as I was so scared to be part of those videos, and I told myself, you know what, I haven't healed enough. But for me to have the strength to you know what, let me just share my story. Let me tell everyone that, okay, this is my story. This is me, not being perfect, but do you see yourself through whatever that I'm saying? Or do you want to be free of whatever that is eating you up? Because I was once depressed, I was once in pain, but now that I'm part of those videos as well, some of them, they relate. Once they hear and then they see you, they'll be like, okay, how did you do it? Because I've been suffering for this. So they relate more when they see you on the video and they see you in front of them. They'll be like so surprised of, how did you do it? And I get a lot of those questions. I always tell them I'm not better, but whenever I speak, I become better.
We asked Vuyokazi why she thought young people were able to open up to peer educators when they hadn't previously shared their stories.
I asked one child that came to me, right, told me, I have been raped by someone that is in the area that I live in. I said, okay, so did you tell your mother? And then this child said, no, because I said, why? I said, my mother will blame me all the time if I'm wearing shorts. My mother will be like, you get raped, you get raped. And now that I actually did get raped, and then she will start blaming me because I'm wearing the shorts. I said, okay, so do you want to talk to someone? I said, if I talk to someone, I'll get judged. So this is like the main thing that the kids are suffering is judgment or being blamed. As much as they are scared to go and seek for help, but also they want people to come to them. So they want that one person who will go to them and be like, okay, let's talk about it. Are you guys okay? And I always ask the teachers, please, in the morning, ask them how they feel, ask them how they are, so that you create the space for them to speak. So I think if we do that, many people can be saved from depression and anxiety.
From the work that is done with young people, we wanted to know if sharing stories felt like a really important part of accessing more help, more support, or more services.
It's so important for them to share their stories. When you have said something that you always wanted to say to someone, right? But you don't get the chance to say it. But once you get that chance, you feel like something has been removed in my shoulders, and you feel like, you know what? Now I think I can talk to my parents now, because I have gotten the idea of, if I talk to someone, I'll feel like there's a weight that has been lifted in my shoulders.
Vuyokazi then told us how she felt about being a peer educator and the impact she thought it was having.
Being a peer educator it's not like it's a job. This is part of me. Peer education is doing something incredible. I can say that, because the peer education goes to them than for them to come to you. Is something else. I had this class, right, that was so disturbing that we wanted to cancel. This class was like, we don't want to be part of this. We don't want to do this. They like making noise, and they're eight girls, right? The teachers were like, these kids may be too much, but I'm sure there's a lot they are doing, and there's a lot that they're going through. I said, okay, let me just try. Let's try to do this class. And we said, no, we want all the 8 girls to come and join us. And then I told them, if you don't want to be part of this program, you're allowed to excuse yourself. But right now, we have to watch this video. And they were like, oh, there's a video that we need to watch. Okay, I'm interested. So they stand there and they watch this video. All of them, they shed tears. And they said, I don't want to speak. I'm like, are you sure you don't want to speak? He said, no, I don't want to speak. And I'm like, okay. How do you feel after watching the video? That's the question that you ask. And they said, hurt. And they said, some of the 8 girls were like, I have experienced that being sexually violated at home. So I know that pain. That's why I feel this way. I said, thank you for explaining. So to me, and to all the organization that we went through, it's a lot of impact. And the kids, they are yearning to have this thing in Eastern Cape and in all of the places that they went to, because once the kids, they don't want you to go, that's when you see I have really made an impact, all of us as peer educators.
Thank you so much, Vuyokazi. You are doing amazing work, and we really appreciate the work you're doing and the rest of the peer educators. Now, I'm part of the work, or rather the organization that does the work on the ground with the peer education. And, something that really stood out and usually does with peer educators is something all of you guys have mentioned, which is creating these safe spaces. I mean, the example she gave is one that is so prevalent these days. It's people being so closed off until you create the space that they feel safe and comfortable enough to share. And also then you understand that, okay, I'm not the only one that has actually gone through this over here. So it kind of gives credibility to you being there, I think a question I can pose to all of you over here is, how do you think services can be more deliberately inviting and safe for young people?
From my experience, as an artist, I've interacted with very many young people. They don't talk to people, don't do things because they feel they'll be judged. People don't take time to understand young people, especially this old generation that is in different professions, like let's say counseling. They don't understand how a young person would express him or herself, because they tend to focus more on the older ones, forgetting the young people also have problems.
So what do you think is important when it comes to creating a safe space where young people feel that they won't be judged?
Creating a space for young people should be a place someone cannot be judged, because if they're judged, they will not turn up again. And involve someone who understands a young person. I noticed there was a big difference, because there was a time a young man was trying to kill himself. We met him in the action, actually. We had to inquire from him what was the issue. He told us that he went to a government institution. He found an older woman who didn't understand him. When he was trying to talk to the older woman, telling him what he was going through, there was a counter, there was a cross purpose. These two people weren't getting along. So like the young man felt this older woman wasn't understanding him. So we felt it was just a suggestion. We had to suggest to our county government to provide a safe space for young people, which has young graduates in counseling that can help the other young person to maybe move along and counter depression and the mental health issue.
Thank you, Mutua. And we are going to get a little bit more in depth about what it is that you're doing now, using your art to create these safe spaces online. But I think the work that you're doing is absolutely amazing. But we all know creating safe spaces is even harder for key populations facing stigma and discrimination. Viet, could you tell us a bit more about how Lighthouse is trying to create those safe spaces and how important that is?
Yeah, thank you for this question. And I would be very glad, to inform everyone just a little bit about the work that we do here at Lighthouse. We do a lot of different work, and it comes from, starting with community outreach, community-led research, intervention and design, capacity building, and lastly, advocacy on a political, national and regional level. I could definitely say that a lot of our work, if not all, comes a lot deeply rooted in peer education. You probably are wondering why, like it has to be peer education. We started out as an interest group, like safe space for like anyone who identify as key populations at the time. It was a safe space for young key populations who were so marginalized at the time in Vietnam. Just imagine that. To be in a room together and exchange knowledge and how they could form an alliance to sort of advocate for prevention and treatment in regards to HIV for other young key population identified individuals. Their work started off very sort of community-based from a peer-to-peer lens. From the get-go, like with my work here, I was always intrigued by this peer-to-peer model. The reason why that I was so deeply intrigued is the fact that like it's literally like right in front of me, how it could be so influential, how it could be so empowering to these marginalized youth, whose voices are historically underrepresented.
Mm-hmm. Absolutely. And I can definitely agree with what you're saying just from the work that we do at MTV, staying alive and creating those safe spaces, especially for marginalized group. And I think there's a similarity, in the different organizations that fundamentally we're all wanting to reach young people and create these safe spaces, hence the education and having those one-on-one conversations that are so important. Viet, you've mentioned the barriers that the LGBTQ plus community face when it comes to healthcare, particularly in Vietnam. Tell us a little bit more about them.
First and foremost, I would have to say stigma. Societal stigma is a big thing that is entrenched in the healthcare system, like in the country. And it's evident in the fact that even though the Ministry of Health of Vietnam issued a decision on banning LGBTQ plus discrimination in healthcare, the practices of bias are pretty much still very pervasive in a lot of public health settings. And while it's very, sad to really see that even though, like laws and policies are changing, the people are not. And with my experience, working with a lot of LGBTQ plus youth, what they've been claiming is that they would rather endure the pain while not having any of their health needs met, rather than facing the stigma, the prejudice, the stares, the victim blaming that these healthcare providers put them through every single time that they would pay a visit to like a clinic. The second barrier that I could identify on top of my head right now would definitely be the lack of LGBTQ plus youth voices in how these services are delivered, in how these services or what kind of services are prioritized in these public health settings. Evidence exists that many LGBTQ plus youth face disproportionate rate of mental health disorders, as well as other health disparities such as sexual and reproductive health concerns, HIV and AIDS. Yet, only a few of those health needs are addressed. it seems very clear that the government pays a lot of attention and efforts towards HIV and AIDS prevention and treatment. But what about mental health? What about sexual and reproductive health? Addiction is on a rise, within the gay and bisexual men community. Why are those health needs not addressed? And I think a lot of the times it could be resources are very scant. That's why they have to focus on, the HIV and AIDS epidemic, which is, fair. But at the same time, I think there are still resources that we could devote to addressing some other equally important health needs. And we could only do that by listening to the lived experiences of those who actually face them, right? So I think these voices need to be heard. It's not that they're not trying to get their voices across. It's the fact that we're doing very little to actually listen to them.
Definitely. I mean, I think that's something that I can see everybody's kind of agreeing with again and nodding. Miriam, you look like you have a question.
Yeah, I just, what Viet said, I think is really, really important. And I've been wondering if that is even a possibility in Vietnam, to use more digital health tools to kind of circumvent or avoid the stigma people are facing when accessing health services.
Yeah, thank you, Miriam. I think that's a very important conversation that we should have. And personally, I definitely am on board with the idea of having digital tools, digital platforms as something that could amplify the voices of LGBTQ plus young populations when it comes to accessing information, especially information that is bias-free.
Thank you, Viet, for your response. I think that's really amazing and really insightful.
Miriam, and I'm looking forward to hearing more about what you think could be some other great possibilities for digital healthcare. However, what you guys can't see at home is that Mutua has been hanging on with us through some really bad network issues and some downpours. And I feel you, because currently in South Africa, we're really going through a lot with network issues and load shedding. And it can be tricky when the network is unstable. But I'd love to try and get a few questions with you while you're still with us.
Yeah, I'm here. So before COVID or before everything, I used to be a professional artist doing portraits, doing Kenyan buses. I think you've seen Kenyan buses have graffiti. When the first announcement of COVID came up, I was watching CNN and I was shocked, worried about our third world country, that if it reaches here, what would happen? Looking at our country, it's not that economically stable, that it can be able to take care of people affected both mentally, health-wise, financially. First, I started with about 15 artists. We shared ideas of how we could use our art, one, to spread the awareness of COVID, telling people to take care of themselves. We started by doing awareness murals, but we noticed main problem wasn't on the awareness murals. People are facing other issues like the mental issues, financial issues, and we are looking at a way in which maybe we can bring up a solution to their problems. So we continued doing the murals more and more and more. But for us to get the solution, we had to share the murals on social media. Every weekend, we used to hold like a group discussions talking with young people. But I noticed that the problems were very much deeper. So for that, we decided to contact most public hospitals to see if they could offer counseling sessions for most young people. For the first time, most of them didn't turn up because they felt talking with someone face to face, they might be judged. So we tried telling the public hospitals to come up with maybe a public line, phone number, or emails in which someone can talk to this young person via the phone. As Nicholas has said, these young people need a ear, someone who can listen to them. And for the first week, they received almost 1,000 calls. Actually, even the calls were overlapping. We felt, because even this public hospital do not have very many counseling doctors, we thought of a way we can also print brochures in which you can maybe give quick tips, maybe give away instructions on what to do when you are going through something, who to talk to. And it really worked very, very well. And we were able to reach out a large number. Actually, in social media, we were able to gain very huge following because of what we were doing. Even on the social media platforms, they played a very major key role because even people from other areas, other counties in Kenya were able to open up to us because they felt that these people are doing artworks on mental issues. Maybe I can talk to him or her about it. He doesn't know me. I'm from another county. Maybe when I send him a text message, he might refer me to someone who can talk to me. Yeah.
Wow, that is an incredible, incredible story, and one that is just so encouraging. And now that you have this online community, Mutua, what do you find they most want to talk about?
LGBTQ. It's really becoming a conversation in our community because we as Africans have cultures. Most older people feel that this is wrong. These young people are lost because of the technology. They don't know who they are. They don't have the self-identification. Actually, last week we had to do a piece on LGBTQ so that we can show the community that, you know what, most of them were saying they have demons. They should be excommunicated, of which it's a very serious accusation. We had to look for a way that we can give this LGBTQ community a way to stand for themselves so that they don't have to fear. So we did a mural on LGBTQ. In a way, we had to also educate the community about it, talk to them about it, tell them this is not wrong. It's someone who has just found him or herself. He knows what he or she wants. He has the freedom to exercise what he or she feels it's better for himself. So, and we're able to sit several of them down to tell them to try and maybe stay away from the cultural beliefs that they think they're guiding them. And courageously, very many people from the LGBTQ community came from other areas to support us, to stand in solidarity with the ones that are in my community, of which it worked. For me, I feel it worked.
And he's gone. I know he'll find a way back. But maybe did any of you want to add anything about social media, especially when it comes to mental health?
What I've essentially found is that there certainly is a space for a lot of the discussion surrounding mental health, especially on social media. That's what majority of the population uses the internet for anyway, social media in and of itself. The positive that comes from this is that there is a new language that is born from a lot of the conversations that people can more or less adopt. There can now more or less be language available that can be used, not just labeled, but also design a pathway to find solutions to navigate how they essentially feel. The negatives are, I guess, just as combative in that if there isn't clear guidance on how to navigate mental health, there can be the emergence of things like maybe quasi-experts coming to the forefront. And I think that's something that we for sure want to avoid. But I think for now, the benefits of at least having the discussion to bring awareness is doing more positive than harm.
Thanks, Nick. Yeah, there's still a lot to figure out about social media, and it's changing all the time. I mean, what's next with AI? One thing that's come loud and clear from all of you is the importance of involving young people, in the design of services for them. So let's chat about co-creation for a bit. We recently chatted to Nelma, a VSO national volunteer who wanted to share her experience of being involved in co-creating the Yaya or Sister app. Yaya is a digital life skills app which is part of VSO's Eagle project in Mozambique, empowering adolescent girls to learn and earn. The project is run in conjunction with implementing partner Light for the World in Sofala province. Yaya's aim is to provide 3,000 low literacy out-of-school adolescent girls and young women with a user-friendly, self-directed set of action-orientated, knowledge-based resources on life skills, sex, and relationships to ensure that they have the knowledge to make informed sexual health and relationship decisions. Nelma is being translated here by her former colleague, Kate.
Eu sou Nelma Passe.
I am Nelma Passe. I'm 23 years old. I work for the Eagle Project, which is implemented by Light for the World, although I've worked for other organisations in Mozambique, mainly in the empowerment of girls. and I'm passionate about working in the community for the development of girls. And the Yaya application is a digital innovation that aims to teach and empower girls and young women about sexuality and healthy relationships and rights. It gives them an opportunity to learn from the tablets, but also to clarify things they're not sure about.
O impacto do envolvimento de co-criação no
So
aplicativo.
the impact of the co-creation process was very positive. It made the application more acceptable to the community because they had participated in its creation. If we had done the design, the colours, the voices without the girls, it would not have been accepted in the same way. When a girl is involved, they can have pride in themselves and know that they have the capacity to design something like that. And then that everyone in the community will be able to enjoy it. The process was difficult. At the beginning, the girls weren't certain of what was required and they didn't feel very much at ease. But every day they grew in confidence and it got easier as they talked more freely. What I discovered was that the community itself could find responses to problems. The girls had ideas to resolve problems themselves and already knew a lot of content about sexuality and health education. So they could find solutions themselves, but they just needed confidence and support and help to be able to do that. Through the process of co-creation, the girls opened up and they found that with sexually transmitted diseases, the girls knew that the best place to get them treated was in hospital, but they had fear about it, fear about what their community would say. And I was able to say to them that it's safe, you can have confidence. So they knew that they wanted to go, that it was the right place to go. They had that knowledge already. And they just needed a little bit of help to have the confidence to go. They went, they got treated, they found it was safe. And this also helps in the development of the content for the app. We included more about confidence. We reinforced confidence and the importance of girls going to hospital.
Qualquer decisão que for que envolve a comunidade, eu digo
we really
que
need to know if a community is going to accept our solution or not, whether there is a need or not for what we're providing. In the communities we work with, people don't speak openly about sexuality and it's a bit of a taboo. The impact wasn't just for the girls. We reached a phase in the programme where we included the elders and the respected women of the community in checking the translations because we had found that some of the terms we were using were not acceptable in the community. And so we included a wider range of people in the focal groups. And this was really the first time that communities were speaking openly about sexuality. And they made a statement that it had a big impact on them because it changed the way that people viewed sexuality and talking about sexuality. Just to add, the co-creation process and the involvement of the community is not just important for us, but also for the participants. The girls really, in exploring their ideas, developed self-esteem and were able to believe in themselves. When they are saying, I think this about sexuality, the girls clearly developed increased self-esteem. They could express their opinions about sexuality and feel that they were important and involved in what was going on. This had great benefits for their own self-esteem.
Thanks, Kate and Nelma. And if you want to know more about any of the speakers or projects in today's episode, please head to the episode notes or to childrenandaids.org/HIV Reimagined. But back to you guys. I'd love to know how much you feel that involving young people in service design could help address some of the problems that everyone's, kind of been speaking about individually.
It's definitely crucial, if not paramount, to include young people in the very early stage of the service design. That's where the service will be shaped the most. And not just in any capacity, but in actual leadership, in actually positions that they themselves could make decisions on how these services can be made. I feel like that's like an important point that no one should miss, because a lot of the conversations in the region and globally have been, we need to increase the participation of youth in service design. But I feel like the bigger question is, in what capacity are you actually involving them in?
I definitely totally agree with what Viet said, but I also feel like just having a seat maybe also not enough. I feel like a lot of organizations, a lot of institutions are having youth councils, youth representatives, but I feel like those young people bringing in their voices to also have to be valued for what they're doing. They have to be compensated, but because I feel like you also have to pay young people to bring in their very valuable opinions on service delivery and service design. And that really, really has to be valued. And people have to be empowered, of course, but I feel like money is a part of the component that cannot really be left out of that. So I would love to see more young people actually, like Viet said, representing the needs of young people, but also actually being valued for what they're doing and saying.
100% agree. Definitely. Okay, so if it's about creating services, do you think enough is being done to understand what's already working for young populations, especially young key populations?
I feel like for each country in the Asia Pacific region, there's just still so much that we don't know about the preferences of young key populations when it comes to services. And most of it comes from the fact that there are very scant resources when it comes to trying to understand those things. We put a lot of money, we put a lot of efforts when it comes to designing services, but we actually forget the part where we need to collect data, and actually quality data that is representative, that is inclusive of different groups of young key populations in order for us to have a strong basis of data. Then we're going to have more inclusive and more holistic service delivery in the end. We could do so much better, and there are definitely gaps where we, like all of us, can collaborate and attempt to fill.
Maybe I could say something. Maybe just be transparent and open that you're not really sure on how to communicate or how to approach young people. I think young people really value honesty, and just making the first step is always appreciated, I feel like. So just be there, be open, and try to communicate and then learn from the process. But also, I feel like I haven't really been in that position as maybe Viet or Nick have been. So I don't really work with young people. So maybe they have more to say about that.
I mean, you might not have worked with young people, but that is a great response, Miriam, because I know young people for sure. And that is exactly what it is. Honesty, transparency. Nick, do you want to maybe add on to what Miriam was saying?
Yeah, I probably say the first step is acknowledgement that there definitely is a problem generally with the space in and of itself. They should understand that they probably don't have the answers, and they should also acknowledge that as well. However, they should be mindful that whenever they are listening to young people, that they should be gentle.
Very good point, Nick. Well, everyone, listening to young people, support them, put them in positions of power, and pay them. Well, it's time for us to talk about something a little bit different. We've talked about listening to young people, but what about trying to reach them in new ways? Here's Jay and Arnold from Usiku Games to tell us about it.
So I'm Jay Shapiro. I'm the founder of Usiku Games and chairman of what's called the Pan-Africa Gaming Group, and I'm here in Nairobi, Kenya. So Usiku Games is what we call a social impact game developer. So we make games for educational behavioral change purposes and very often health related. We have more internet-connected smartphones here than all of Europe combined, more than all of the United States, Canada, Mexico combined. And those numbers are growing at 20% year over year. Most NGO-type programs or health-based programs are oriented around trying to get the beneficiaries to adhere to a different behavior in some way, whether that is to be more fit, to eat differently, to think about their body in different ways. And so what we try and do is to take those elements and build them as inferences within the game so that the positive behavior is incentivized through rewards in the game itself. One example is we did a game that's sort of very fitness oriented, trying to get more women into amateur sports, playing football on the pitch in the neighborhood type thing, and also to reduce gender-based violence. And what was interesting about that example is that it was a football-based game, and the character that you played within the game, in order to succeed within the game, you had to increase your skills and stamina in the game, and the only way to do that was to physically go outside and exercise and play football itself. Using the Google Fit API, we tracked the steps, and then the more active you were physically, the more your character in the game would increase in strength as well.
My name is Arnold Mwanjila. I am a head writer at Usiku, and that basically means that I am in charge of the narrative that we use in the video games and the mobile games that we do. The most recent one was called Sister Stories, and it's a story that was trying to engage young girls to discuss and talk about the changes that they go through during adolescence. So menstruation, puberty changes, all those things. And we worked it into a sort of RPG space where they walk around a town and talk to different girls and try and help them with whatever problems that they are having in terms of their own self-awareness and their own changes that are happening. RPG stands for role-playing game, and in games, unlike video movies and novels where you're kind of engaged separately from the material, with games, you are the story. So you are the character, you play the character, and you go through a fictional narrative that we set up for you so that you can go through the puzzles or the story, or figure out what you need to do. Most of the times with issues of, say, tax or whatever, that people just go over people's minds, nobody wants to be talked down to about these things. No one wants to be told, don't do this, don't eat that. No one wants to hear any of that. What we do with the games is none of that. We show them a path and we let them decide and we let them choose, and they kind of come to their own realizations on their own. They assume that role, they assume that character, they become that person. And so for them to navigate through certain challenges within the story or within the game, that has an impact on their psyche, and that has an impact on their behavior as well.
We have a few core principles. So for starters, all of our games, as I say, are made in Africa for Africa. And so the characters and the environments and the situations represent their African lives. They can see themselves reflected in the game. The second thing is we treat women, and in fact all genders, as equals, not objects. And that's a little bit different from the history, unfortunately, of what the gaming industry has had. The third thing is that our games are all non-violent. There's no guns in any of our games. And then lastly, all of our games have this element of education or behavior change baked into them from the beginning.
I'm a young dad now, right? Two-year-olds, twins, and that's top of my mind, right? It's top of my mind. It's how do I take care of these kids? And I never really had anybody to show me the way, or maybe they did and I just didn't listen because, but if they had shown it to me in a video game, I probably would know what to do now, right? So that's kind of approach that we had taken at Usiku Games. It's definitely think different, be different, do differently. And that's one of the best things about gaming. It's you can actually engage people in these ways and show them options and help them navigate their way through life.
Thanks so much to Jay and Arnold for talking to us. Arnold, I hope you're figuring out that parenting thing. I know it can be tricky, speaking from experience. So if you want to see some of Usiku's games in action, head to childrenandaids.org/HIV Reimagined. I think for myself, there's maybe some things I don't particularly understand about digital health. And so what do you think is the most common misunderstanding or misunderstood thing about digital health?
It's not about digital health, but it's about providing services to people through digital means. Digitizing things is exciting. But I also understand when people have their reservations about data privacy and security. But then I think we really have to get together, develop data governance frameworks that keep people and their data and their safety at the center, at the core of digital health. I really believe that digital tools can help, but they're not a solution for fragile health systems. They're not a fix-all, or not an easy fix for inequalities and inequities that have been really ingrained in the health system, but also in society. So I feel like that's a big thing that has to be acknowledged more, that it's not just a simple fix. It's not done by developing a new app or a new system for data collection, but there are more central problems underlying that have also be addressed.
So not a quick fix, but something to help enhance or support. Do you think you could share examples of where you think digital health tools are getting it right for young people?
I feel like in the past few years, a lot has been happening. There's a lot of focus on making it more inclusive for LGBTQ individuals, but also for hard to reach communities that are maybe not in the network coverage or don't have easy electricity or internet access. So really trying to get everyone the access to digital health. I think that's something that's really important, and efforts are going on to make sure that people are not falling through the cracks or not left out. I also think that getting more diverse opinions on what kind of services are needed in the digital health sphere, I think that's also something that is progressing. It's common practice to now do really comprehensive user personas or user stories to really get behind what are people actually needing. And there is a lot of co-creation going on, trying to work together with the communities, with people that those digital tools are for, to make sure that it's actually something that they need and that they want. And then tweaking, modifying those digital health tools to really get the people what they need. I'm really excited that digital health is not just about commercializing health, but actually giving people what they need.
Yeah, these are really interesting points, I must say. Thanks, Miriam. Okay, now I know the episode has been longer than we thought, but it was so interesting hearing from all of you. And I just have one last question before I let you all go. All right? Is that okay? Okay. HIV Reimagined is all about doing things differently. So if you could choose just one thing to do differently in healthcare and services for young people, what would you all choose? Nick, maybe we could start with you.
We had touched on getting young people more involved in just creating solutions, but I think the more targeted approach should be creating a human-centered design around how we think about holistic healthcare for youth. And this is like a principle that we probably learn in like app creation or just software design. It's more like an agile principle of sorts. It more or less dictates that you would bring the subject, in this case, the youth participant or youth generally, to the forefront, guide them through and expose them to a range of possibilities or a range of scenarios in which they feel heard, safe, and possibly even unsafe. Gauge their responses to different scenarios, understand what exactly triggers them, understand what exactly makes them feel heard. And then through that, we can create different pathways towards developing solutions that are more tailored towards them. And this is not just through the lens of mental health. This is overall throughout the healthcare system. That is probably something that is not looked at properly. There isn't a streamlined way of gathering feedback in order to iterate on whatever it is that we need to serve young people.
Thanks, Nick. So a more human-centered, youth-centered design process at the heart of healthcare. That's nice. Viet, what about you?
Yeah, I just have one more point to add to this, and that is I would like to see the healthcare system being less of a top-down system. It should be more of a lateral system. Young people should not have to go through so many hoops and so many levels, just to get their voices across and their needs being met. And what that means is that with the current healthcare system, at least universally, I think there's still that sort of mechanism where Ministry of Health would pass whatever decisions or protocols that they're doing for certain, healthcare procedures or services. And then, the public health hospitals are going to follow them and then carry those services out. And then young people are going to be the beneficiaries of such services. And I don't think that should be the case necessarily. Any decisions that affect the lives of young people should be based on their opinions, should be based on their lived experiences, should be based on what they themselves see as priorities in terms of health. So I really do hope to see the healthcare system switched from being a top-down system to a more lateral system.
Thanks, Viet. So basically making sure young people's voices are heard very loudly and clearly and taken into account when designing health systems for them. Okay, Miriam, what about you? What one change would you like to see?
I really totally agree with what has been said until this point. I maybe just wanted to add that I really think is so important to offer like education and capacity building for young people especially, so that we actually have the skills and the tools to be empowered to make our own decisions and to come into decision-making processes.
So essentially not just being listened to, but being supported in all the right ways. That's a great point. Now, Mutua, we know you're still having network issues, avoiding rains and trying to stick with us, but hopefully you'll be able to share your last thought with what you'd like to see done differently in healthcare.
Well, I think the thing that can be done differently, they should look for younger people who can work with the young people. Because a young person is more comfortable talking to a fellow age mate rather than an older person. So that one becomes a little bit easier and it will solve a lot of problems that are happening to these young people. Yeah.
I'm so glad you got to stay with us and were able to answer the question right at the end. Thank you so much, Mutua. And to Miriam, Nick, and Viet, you've all been absolutely great. And I hope you've enjoyed yourself as much as I have.
No worries.
Now, if you're listening and want to find out more about any of the great people or projects that we spoke about today, please head to the episode notes or the HIV Reimagined blog at childrenandaids.org/HIV Reimagined. And make sure you're subscribed to get the latest episodes of the podcast. I loved talking to our great studio guest today. So I hope you had lots to take away with you and think about. Shafiq will be back next time. So it's bye from me and thanks for joining me today. Shafiq.
Don't worry, Stephanie. I'm still here and love listening to everything today. Thanks for taking over the reins of HIV Reimagined.
You're most welcome. I had an absolute blast and I've learned so much.
And thanks to you at home for listening. As Stephanie said, please do subscribe as well as leave ratings and reviews so we can help others who might be interested in finding HIV Reimagined. Now, we've got a great episode coming up next, all about the innovations in diagnostics and where it might lead us. So see you then. It's goodbye from me.
And bye from me. Bye.